Speech buddies are a set of tools specially designed to help people overcome articulation disorders. These speech disorders affect more than 6% of all American children. The problem is primarily caused when the tongue is placed in the wrong part of the mouth when speaking. This misplacement may cause people to incorrectly produce sounds or substitute one sound for another sound. Speech buddies use targets to help patients improve their tongue placement and coordination. These tools assist patients in finding the right spot to place their tongue inside their mouth. When contact is made and the patient attempts to produce the sound, it is highly likely that the correct sound will be produced. Correct pronunciations with your speech buddy eventually lead to correct pronunciations without your speech buddy. Now that you see how the technology works, let's help you learn how to use it. For the S and SH sounds, position the speech buddy tooth stop on the front face of the top front teeth. Simply hold the handle still, and the speech buddy target will be positioned accurately. When the tip of the tongue touches the target, it is in position to pronounce the sound correctly. You can easily remove or position the speech buddy at any time during therapy or practice. If you have the L or the CH devices, you will be positioning the bend on the back of the top front teeth. It is important for your speech buddy target to be flush against the back of the teeth. We suggest placing the tip of the speech buddy in the mouth, then pulling back along the top teeth with just enough force to hold it in place. You can adjust the position of the node by angling the handle if necessary. The R speech buddy encourages the tongue tip to curl up and back in the mouth, a motion that is necessary to correctly produce the R sound. To use the R speech buddy, hold the handle with the speech buddy logo pointing up, and position the coil in the mouth such that the coil is directly behind the upper front teeth and centered in the mouth. Hold the speech buddy loosely in your hand and confirm that the two sets of bumps on the speech buddy's coil lightly rest on the tip of the tongue. These bumps help the patient feel the correct starting location for the tongue. The tongue tip should fall between the two sets of these bumps. Ask the patient to confirm that he or she can feel these bumps before attempting to use the R speech buddy. Once the speech buddy is in position, hold the handle firmly and ask the patient to attempt to unroll the coil with his or her tongue tip, while simultaneously saying the R sound or a simple word such as ring or rabbit. If the R sound is pronounced correctly, the patient will be able to feel the speech buddy either fully or partially uncoil. If the sound is pronounced incorrectly, it will not uncoil. The patient should be able to clearly feel this difference with his or her tongue. If the patient is unable to uncoil the R speech buddy with the tongue tip after repeated attempts, adjust the position of the coil by angling the handle or moving the coil slightly deeper or shallower in the mouth, and then try again. Once correct positioning has been established, repeat as necessary until the R sound has been correctly produced. Once the patient has become familiar with the use of the speech buddy, you may encourage the patient to use the speech buddy by themselves and enhance his or her confidence in producing the R sound. There are great resources at www.speechbuddy.com, where you can find exercises, games, and other services that will help you use our products.